Precious donations of skin arrived today from America, ready for use in painstaking, labour-intensive, life-saving operations. 21 people remain in hospital after suffering severe gas and thermal burns in the eruption of Whakaari White Island. New Zealand is regularly supplied by American skin banks, but never before has requested this volume. For more on this, we're joined by Dr Sarah Morley, the clinical lead at New Zealand Blood, the agency responsible for collecting and maintaining medical skin stocks. Good evening, Dr Morley. Can you tell me what has arrived into the clinic today?
So we have had a delivery from our US partners today, but what I can tell you is that we've been supporting the burns teams with donated skin every day since this tragic incident, and this shipment today is simply keeping our stocks maintained so that we can make sure we meet the needs of their patients.
Can you give us an idea of how much has been used so far, perhaps compared to what you would normally supply?
Yes, absolutely. So as of this point today, we have issued the equivalent of around about this New Zealand usage over the last 3 days, and we are expecting to issue over the next 3 to 5 days another 2 years' worth of average use in New Zealand. So this is a really substantial increase in our requirements for skin donation.
So you are using, just to be clear, in a matter of days, skin that would normally provide for our needs for years?
That's correct, yes.
So where does that leave us in terms of supplies?
Well, the good news is that because we have long-standing partnerships with some skin banks in the United States and in Europe if necessary, we're quite confident that this will not impact our ability to supply usual New Zealand patient needs over the coming year. The key thing from our point of view is that we're working really closely with the burns teams, liaising with them regularly each day to make sure that we can plan and manage the skin for these critically ill patients injured in this tragic incident.
I know cost is not an issue here, that we were told by the Director General of Health that the cost has been signed off. But can you give us a bit of an idea? What does it cost to get skin in, to buy skin?
So the cost to import skin is of the order of between $3.50 and $4 per centimetre squared of skin. So we are talking about a costly product, but equally one that is considered cost-effective and beneficial for patients. And that's the most important thing, is that the cost is offset by the advantage it gives to patients in terms of improved recovery.
But in terms of the volume that we're expected to use, we're talking about millions, aren't we? In terms of the cost of it. Yeah. So, yes. Look, people would probably know about donor organs, being able to give vital organs. But what would you say to them about skin? Because this skin comes from donations, doesn't it?
It does. And the skin comes from donations from our deceased donors, from our New Zealand donors. It's predominantly where families have agreed to the donation of organs and tissues from their loved ones after they've died. And I think one of the key messages we would like New Zealanders to take away around this issue is that skin is an important tissue. It is an important gift from donors, and that it's also really important that we have New Zealand donors who help us in this way to manage patients who need organ transplantation, but also many other treatments, including skin for treatment of burns patients. I think if I could ask anything of New Zealanders at the moment, I would ask them to think carefully about whether they would like their tissues and organs to be used to help others after they die. And if they have that, if they reach a conclusion, to discuss those views with the people that they love and share their views so that everyone in the family knows where they stand. That kind of thinking now can really help the right decisions to be made at times of stress and difficulty. And it really does help promote and make people think more widely about organ donation and the benefits of it. And that would be a very important thing for every New Zealander really to think about.
Thank you so much for your time this evening. That's Dr Sarah Morley, who's the clinical lead at the New Zealand Blood Agency, and they're the ones who are responsible for collecting and maintaining medical skin stocks.